Hello, hi guys, what's up? This is Dr. Zero Melia, MD, MHA. This is the third iteration of this module. I tried to do it over the weekend, but I'm a very busy doctor, and I had to remake this a couple of times just to get it right. Anyway, let's go to our module one. So, hello and welcome to the students of the Manila Times College School of Medicine. Welcome and good day. Hopefully, you find this thing instructional. And to all those on YouTube, this is going to be public. This is going to be available anytime because the Department of Health has difficulty in displaying this series of lectures of a training called Medical Certificate Cause of Death, which is supposed to be available in their website, the VOH Learning Academy. But as a public service, I'm going to make this thing available for all medical professionals out there. So, uh, you know, barring unforeseen circumstances, we're gonna go ahead with it. Um, hopefully we're gonna get through all of this. This is the first lecture. This is the first lecture for the training, and this is going to be Taglish or Tagalog in English because so that I can very fluently do this without stammering. I tried a full English before, and I got nahirapan. There was a lot of difficulty doing this. Um, I had to record this because of time constraints. I wanted to do this face to face on February 21, 2024. This is the schedule for this module, but unfortunately, because we have a general assembly going on in the city office of Olongapo City where I work, we're gonna have to do this virtually. But this will be recorded. Um, this will be recorded live. I'm here at my home. Yesterday I was at a ZMMG Co-op hospital, but I'm here at my home and we're gonna do this right now. Okay? So bear with me. Okay? Tatagalog ng kaunti, pero this is part of the DOH program. So this is my certificate of completion. I was able to complete the training of trainers on medical certification cost of death last 2023 at the Xenia Hotel. If you're wondering where I am at this picture, I'm the one wearing green on this on the picture on the right. Okay, so let's put up the pointer. That's me right there. My friend Dr. Tuban was unable. We were not given the proper instructions, but you know, everybody of us in here were doctors, except for the DOH staff, okay, which comprised some are comprised by nurses. Um, this we were part of the second batch of the training of trainers in Central Luzon. Okay, so here this is the part of the health sector strategy 2023-2028 upgrading ito. So we are upgrading the services for the Filipino people by one of them is the training for the medical certification cause of death and the smart verbal autopsy. We will get into smart verbal autopsy probably later, but um, lahat ng mga tuturo ko sa inyo is like the verbal autopsy. It's the verbal autopsy. The smart verbal autopsy is the computer program designed designed by the DOH. Unfortunately, it is a lot more resource intensive. Mas malaki ang kailangan niya sa may laptop. Okay, for you to install it. We are having difficulties with it, but we're gonna go through it siguro saglitan lang. But anyway, let's go through with the slides. Wait lang. Try natin then update lang yung aking OBS stream. Okay, there we go. Okay. So, what is civil registry and vital statistics? I'm going to be referring to CRVS most of the time, okay, in all of the lectures. So, what is CRVS? This is Civil Registry and Vital Statistics. This is the continuous and universal recording of the occurrence and characteristics of every individual's vital events. Okay, so our training will focus on birth statistics and death statistics. Most of the time, ito yung importante. This is the important part of the training in Philippine public health practice. But the civil registry and vital statistics doesn't just include that. It includes also marriage. Okay, so birth certificate is the document that says that for an individual, hello world. Okay, it's a hello world to the people. I'm alive. Okay, I deserve some rights. Okay, especially universal healthcare. In universal healthcare, a person will be given rights to universal healthcare if he has a birth certificate, okay, that identifies him as a receiver of the benefits for the universal healthcare. So, importante yung registry of birth, okay? And then the marriage certificate is the union between a man and a woman, and this will be also be a public document and will be used by various agencies, um, especially since you're starting a family. Okay, so importante din po ito. Okay, ang marriage certificate, kaya po yan ay nire-record natin sa ating civil registry. And then the death certificate is the goodbye. Okay, this is the time I had in the world. Okay, and then this is goodbye. So why is that important? I'll show you why it's important to have a correctly identified na death certificate. Okay, because the death certificate is going to tell the other people about your life. Ano ang mga naging problema at what were the problems in your life that led to your demise and that could help other people living right now that could potentially have the same disease, and then maybe we can do something about it in the future. Okay, so let's go. Anyway, wait, I'll check. Okay. Oh no, that's the pen. So sorry about that. Laser pointer. Laser pointer again. Okay, click. Okay, let's go. Civil registry and vital statistics. Activities in the Philippines are recorded by the Philippine Statistics Authority. This is the department, this is the body that will record all of the civil registry and vital statistics inside the Philippines. So, if pinakasal ka sa loob ng Pilipinas, dito yon ma-record. If you were born here in the Philippines, this will be the recording. Also, if you died in the Philippines, Philippine Statistics Authority will hold your it will hold your documents po. Okay, so vital events can happen also when you're currently living abroad. It is up to the Department of Foreign Affairs to record these vital events. And there are 10 million Filipinos currently outside the Philippines and all their vital events. So if namatay ka sa ibang bansa, if you die outside the Philippines, the death certificate will be forwarded to the PSA. Okay, so that the PSA knows that this individual has already died. Okay, or he got married. Okay, and then merong mga pinapanganak. okay, sa ibang bansa, and then the Philippine Statistics Authority may know about this, okay? Okay, and then nare-register siya. Okay, so there are 1,634 local government units by resident local civil registry offices. So when you go to your city hall or your municipio, you will see an office there called as local civil registry office. This is where you file for the marriage certificate. So a lot of people only meets this LCRO during the marriage certificate process. And then pag nanganak o kaya nanganak na si Mrs., okay, you have to file the birth certificate. Most of the time, it's done in the hospitals here in the Philippines, but the process is that the document is passed over to the LCRO, LCR, okay, for short. And the LCRO has a registry book with registry numbers. So these registry numbers are unique within the LCRO, okay? And then they are passed over to the Philippine Civil Registry Information System. So this is important because once it's passed over to the Philippine Civil Registry Information System, it takes a legal process in order for you to change the various documents. So, maririnig nyo in your practice as a medical doctors, maririnig nyo yung, you're gonna hear about people requesting for a medical certificate certifying that the patient is male. Okay, there have been and there are mistakes happening, especially sa birth certificate. Okay, because of the name. So marami pinapangalan Michelle when it is actually Michael, okay, or different pa, Jean is John pala in pronunciation because Jean is in the Philippines a female name, but can be used as a French derivative, so Jean. So may mga ganung pagkakataon. There's that ano po that the hospital administration may make a mistake and then write that it's a female baby. Okay, so uh, if it is registered already in the ano po, and that's why it's important to have correctness verified. Okay, it's verified na dapat tama yung pinasa natin, pero ang problema ay madalas ay because of the circumstances, sometimes the father or the other relatives forgot to see it because it's just one letter, F or M. Okay, so forgot to check, and then it gets passed, and then once it gets passed, it actually takes legal proceedings in order for you to change female to male. Okay? Even though it's obviously a male, na yung patient mo is a male, but dahil nagkamali, they are going to have to go through the process. That's why there's a payment. Okay? When you have to change it. So in order for this to not happen, it's everybody has the obligation to verify the correctness, the validity of the information before you pass it to the local civil registry office because it's a very tedious process, especially if magma-migrate na. Okay, if they're going to migrate to um, other areas also in the DFA. Okay, another problem po is with getting the passports. You have to have the birth certificate, and then the marriage certificate is erroneous. Okay, so we have patients po na iba yung birthday sa marriage certificate nung nung isang participant. So ang nangyari is they could not get, it takes about 2 years just to get through all the process of changing a date in the, just as a simple date, it takes two years. And then the death certificate, Although death certificate, not much, except with insurance claims. Okay, so insurance claims ay problema just because of errors in the death certificate. And then you have to write medical certificate certifying that this patient is this or that it is the same patient um, sa may mga lawyers. Okay, so it's difficult if you have erroneous. And then we're going to discuss more on what it means in the public health system. So there's an interagency committee on the CRVS. We're going to discuss this one because this is actually part of their plan. Yung updating or upgrading of the system for the civil registry and vital statistics actually began 2010. So one of them is to have one of their plans is to have the interagency committee on CRVS. So in here you can see the different agencies that have a say in the various documents that are passed for civil registry and vital statistics. So one is the Philippine Statistics Office because it's the central repository. The Department of Health because it's one of the bodies that processes these information along with the Commission on Population. Okay, and then the Department of Foreign Affairs kasi nga one of the jobs that are important here in the Philippines is the uh, skill transfer. We have OFWs outside. That's why there are a lot of Filipinos because we train uh, here in the Philippines para lang makapagtrabaho and earn dollars or whatever para lang makapag-provide dito sa mga pamilya natin dito sa Pilipinas. And then that's why the Department of Foreign Affairs is in charge of anything that happens to Filipinos that any event that happens to Filipinos abroad. Okay, so Department of Justice because these are legal documents. So important po na tama, verified, and hindi na kailangan na pabalik-balik pa dahil hindi pwedeng basta-basta lang palitan. So it has to go through a lot of process with the DOJ, and it has created a lot of problems with a lot of Filipinos before. Okay, we're gonna discuss on that later. Department of Education, of course, because they require the certificates prior to entering grade one. Department of Education, Department of Social Welfare and Development, because they are in charge of um, children, okay, and women that will receive their benefits, okay, especially maraming mga Filipinos indigent or poor are need those documents, okay, present with them so that they can receive welfare. So TILG and then the Office of the Cabinet Secretary are there to uh, what do you call this, as a monitoring body, as a surveilling body. They are the ones that report to the president that there is a problem with certain statistics. Okay, so what are these statistics? So we're going to discuss that. One of this is registered death. So we're discussing only the death certificates from this point forward. So we're going to discuss siguro the other CRVS activities on another set of trainings. So let's go here. Here's the registered deaths. Okay, registered deaths in the Philippines, 1903 to 2021. So in dito sa baba, in the bottom of the picture, this is the number of registered deaths. Okay, so it has been steadily increasing as the population of the country is increasing. Okay, there are highlights here. Okay, now what are these highlights? These are highlights, these are the ones that have 0% changes. So itong nakikita nyo na merong parang ECG, the ones with the ECG, this is the percent change. Okay, so there's been a big change in and then this became zero. And then this became zero. Okay, there's a 72% increase change during the 1917 to the 1920 to 1919 or 1920 period. Why is that? Okay, 1917. I just happened to research on the area. Okay, 1917, 1920. This is the part of the Great War. Okay, so First World War. So the Great War. So at that time, the European stage is the basic what we know. This is the what we know of the World War One. Is that the European stage is that where all of the soldiers combine trying to fight over Europe. So what we did not know back then is that because we are a U.S. colonial bansa or nation, we were able to send troops in Europe, okay, alongside the US. Okay, it was around this time. Also, around this time was the Spanish flu. So the Spanish flu did not just affect the, no, it's a pandemic. It's one of the world's destructive pandemic. It killed more people than soldiers died in the Great War. So that's something that you will read on if you read about the Spanish flu. So this happened during this period. So this period was in turmoil because there was in terms of health. Okay, a lot of infectious diseases cause this spike. So this is an important spike because most of the registered death spike happens when there is a pandemic. So in here in 1923 to the 1920, 19, well, yeah, up to the 1930s, this is actually a transition period. So this is a transition period from the American colonial area to the Commonwealth area. So the American colonial workers were being transitioned off. So napapalitan, they're changing to Filipino workers uh, to handle the civil registry and vital statistics. So there is little to no change during this period. In here, you're going to see the Second World War, okay, 1941, 1945. So you got 0%, but then, this is marked by diseases and everything, but this is the time when the Philippines lost, okay, to the Japanese, and then there's a time of rebuilding. So a lot of deaths were not registered here. So, ayan, makikita nyo po yan. So, I just researched that from online sources. There may be some speculation to what I'm saying. That's not actually from the PSA, but I want to be clear on that fact that during this period, yeah, during this period, that's what I found. Okay, that these are missing some data. This is because of a pandemic. And as you can see here, this is also due to a pandemic. Actually, um, in a recent trip, I learned that in Central Luzon, okay, during this period in 1963, there was another flu outbreak in Central Luzon. Okay, so in here you can see this very there's these spikes of death. There's a percent change, and that's important. But in here you're going to see the latest one. In 2021, there is a 43.2% increase in the number of registered deaths. If you're Of course, we all know what this is right now because this is the COVID pandemic. Why that happened? The COVID pandemic started in December 2019, and then in 2020 there were barely enough deaths. Why is that? And then why is that in 2021 there was a surge of deaths? Okay, why not in the 2020? We're gonna discuss that further, and that's why these things are important. So, for formality, this is on the left side is the number of deaths to in intervals of 100,000. This is the date here in the x-axis, and then this is the percent change. Okay, so let's go on the next slide. So that's statistics. Okay, so if you're the president of the Philippines and you're going to see the death statistics in the past 10 years, okay, this is going to be what it's going to be about. So why is this important? Because if you're the president at that time, President Duterte, you're going to see, oh my God, we have an increase of 43% number of deaths. Okay, during this period, it was steadily increasing. It's noted that it's steadily increasing. You know, it decreased at this period. So why is that? Because the population of the country is increasing. What does it mean when it decreases? It means that the healthcare is up to par. So if you have decreasing number of registered deaths, ibig sabihin gumaganda yung ano natin, yung healthcare system. Unfortunately, this is the 2020. The 2020, we have lockdowns. Okay, we have lockdowns. That's why there is a very big effect on the number of communicable diseases. So sa communicable diseases, yun ang makikita nyo later why there is an importance um in public health to control communicable diseases because once the out once the uh, lockdowns were removed, boom, and then this is actually due to a new COVID strain. So the crude death rate in the Philippines, crude death rate is actually computed per 1,000 persons. So crude death rate is the number of deaths per 1,000 persons. So in here, you can see 5.3 people per 1,000 persons die in 2012. And as of 5.4, 5.6, 5.6, and then it went down 2017. So it's nice to look at why that thing dropped in 2017. There must be something, some health event that caused this because it reduced the number of mortality. So it increases and then it drops in 2020. Of course, we don't all know this right now because of the lockdowns. The communicable diseases were significantly uh, abated. So hindi lang yung COVID. Almost all of the communicable diseases were decreased during this period. And then it went up. It just went up 8.0, okay, per 1,000 persons in the population. So statistics in perspective. So what does that mean? In 2021, these slides are actually from the Department of Health. It's a lot different now. It's 2025. It's a lot different now than it was in 2021. So, but since this is a part of the training, the standardization of the training, I have to use the DOH slides. So, but it's nice to use the DOH slides because during this time, 2021, you have 879,429 registered deaths in 2021. This is alarming. Okay, so especially for the Department of Health, 2,409. Right, let me get into the picture. Okay, so 2,409 deaths per day. That is translated to 2,409 deaths per day. There are only 24 hours in one day, so that's about 100 deaths per hour. So if you translate that to a minute, that's 2 deaths per minute. Okay, and during this period, 2021, I can remember it. I can remember it because I'm one of those people that signs those death certificates. It's almost every day. You get about 6 death certificates, 2 death certificates. It's never zero during 2021. Okay. So demographics. So when you're analyzing. So in 2021 you had the Delta strain. That's the reason. That's the reason that we had a lot of deaths for 2021. So when you're analyzing this data, okay, we have the Delta strain, the variant. The Omicron strain hasn't come yet. During 2021, I can remember it because it's September, October. Okay, that's the number. That's the number. That's the months with the greatest number of deaths, even in Olongapo City where I work. So what does the COVID imply? What happens with COVID? Okay, when it comes to death. Okay, death in COVID happens only to those that are immunocompromised. Okay, very rarely does it happen in the working population. The working population are the ones that are transmitting the virus. Okay, because they have a competent immune system. You can see that because in here, in the under one population, there is a significant increase during the 2021. So they are the ones that are immunocompetent. What is it? Immunocompromised. Okay, they have still to develop. There was no vaccine yet on 2021. So those that are under one have not received any antibodies from breastfeeding. So that's why it's important for us in the public health sector, once the vaccine was given, it is important for us to tell people keep on breastfeeding because we don't give below 5 to the population below 5. We don't give the vaccine to population below 5 because it may entail uh, uh, adverse effects, okay, in the immunocompromised population. So we are actually depending on immunoglobulin A's that are coming in from the mothers, okay, that is passed on through breastfeeding. So that's important, okay. That's important. Why you have this under one here, um, madami, no? It's increased. But then, since the start of the pandemic, the main population that are affected are the are the elderly. So as you can see here, in the male population, those that have died most is the 65 to the 69. These ones here, below that age, okay, below 60, these are the ones that have comorbidities. So you know why we targeted the comorbidities and elderly people to have the vaccines because they are the ones that are being attacked by the COVID virus. What you can see here is that there's a difference in the female population. Why is this? Because it's more on the male population that are more exposed because they're the ones going out of the household. They're the ones that are working. Most of the time, the females they may not work during this period, okay, 2021, because we were slowly increasing the lockdowns to include everybody pwede na sila magtrabaho, they can work already. So the ones that are mostly affected in the female population are those 85 and over. So that's significant right there. Okay, so if you know the context of the no, you can explain this actually to the president of the Philippines at that time. And then when there is an intervention like vaccination, during 2022 we received the vaccination already. There was limited vaccines. So anong gagawin mo? Where are you going to give the vaccines? Okay? You can use this demographics. Sir, we have elderly populations that are affected mostly during the Delta strain. Okay? So we want to protect our elderly population first. So that's why there's category 1. Okay, category 1 included the elderly. Category 1 also included the healthcare workers. Okay, the healthcare workers, us, okay, because we're going to be the one that is going to administer the vaccine. So we're going to get exposed early on during the vaccination period to people who are asymptomatic and COVID carriers. So that's why category 1 included healthcare workers and the elderly. Then the category 2 were those that are not elderly but have comorbidities. These ones, okay? So it's not shown here, but you know that after 40, you're going to have lifestyle diseases, okay? Diseases related to lifestyle, like diabetes, hypertension. We're going to discuss that maybe in a later slide, but this is the main area that is affected by category 2. Okay, so the category 3, we're going to go with frontline healthcare workers. Okay, that's why when you're deciding, you only need this slide, Pagka that statistics, this is important. This is important na nakikita natin because we're going to address decision makers. Okay, the in public health, nobody has greater power than the decision makers. The decision makers have the funds. They control the funds, and then they prioritize. And this is in medical ethics, the principle of justice. Okay, those that need the intervention has to get it. Those that we have to prioritize. Okay, not everybody just gets it first come first serve. There are people who are more at risk. Okay, so those are the ones that we target first. So let's go to the next slide. Temporal distribution. Okay, so this is it. Okay, this is the one I've been telling you about. So during the 2020 period, we have less deaths here in Olongapo. In Olongapo, this is for my practice, okay? Because we were strict. I was strict, okay? I was strict with the staff, okay? We were strict with the patients, okay? We had um, I don't know. We were threatened with lawsuits because they were not accustomed to the lockdowns. But eventually, even though we were threatened, the attorneys themselves they showed their clients this is an emergency situation. Okay, COVID pandemic was bleak. Everybody lost revenue. Everybody was I know forced. Okay, I didn't want to force people, but it is required. Okay, but during the 2020 period, because we need to have normalcy, okay, in our everyday lives. We have to. Oh, wait. Sorry about that. I did not check. I should remove myself here. Sorry. So during this period, we had to have normalcy. So at the latter part of 2020, the Department of Health suggested that eh, uh, we degrade or binaba. Okay, we lower down the uh, community quarantine guidelines. Okay, in order for the country to have normalcy. Okay, so that's why there were frontline workers that returned to their jobs, and then as a result, the COVID cases steadily increase. Okay, so we were still advocating during this first part of the 2021 period uh, that the elderly, the immunocompromised, okay, and the pregnant women are to be still be inside their households. So you can see that there was only a steady increase. Okay, in Olongapo, this reflects much, but we were strict here in Olongapo. That's why the COVID deaths actually are very low in our area. We actually have an award because we were able to control most of the cases coming to Olongapo. Okay, so in the rest of the country, it contributed to this steadily increasing COVID deaths, okay, and thus the death statistics. And in around this time, we have only the priority programs of the Department of Health going on. So, uh, bukod sa COVID, other than COVID, the tuberculosis and the other forms of pneumonia were steadily increasing during this period. I was here. I was tallying, I was getting the updates monthly, okay, with the Department of Health. So I know why this is increasing, and then it suddenly increased here in September and October. If you're going to see the Olongapo data we had in 2021, it's just very small here, and then it just went up here in September, October, because of the entry of what we call the Delta variant. Okay, the Delta strain of the COVID. uh, ravaged India. Uh, it produced a lot of deaths in India, and also here in the Philippines. One of the affected nearby, our nearby neighbor province of Bataan, saw a lot of deaths during this period, and because we were swamped with our hospitals here, our HU, our COVID facilities, we were swamped with emergencies. We also had deaths here, but the most affected was the province of Bataan in our area because the Delta strain was very, very contagious. Okay, there was no vaccines, and there are a lot of people that died during these 3 months. Actually, August, September, October. In here in Olongapo, it was September and October. I can remember it because I actually saw their the columbarium that had the names that I had. Uh, I was able to contact these patients and talk to them, but unfortunately, they died. They were cremated, and their names are on the wall in a columbarium here in the Olongapo, and I can recall them. There were pictures of them, so I can see them. So this was a very depressing period, actually. This is a very depressing period for me and other healthcare workers, okay, because we were able to talk to the patients, but unfortunately, their demise during the Delta strain. This is it. This is it. That's why there's a lot of deaths during the 2021 period. So let's go on. Let's go on. So registered debts by attendant. Okay, so this one is the if but anything. Okay, if but anything, if you're a medical student, please check the box. Medical attendant, attended medically. Okay, medical attendance. We're going to show you that in module two. Okay, so ano ba ibig sabihin na attended by a doctor, medical attendant, in a period of 6 months. At the time this was being taught, they told us that in a period of 6 months was were you the one to attend the patient, okay, that died. Okay, you're going to check that box. We are the by the time that I received this training in 2023, the Department of Health is trying to increase that to a period of 1 year. Were you the one to check this patient that died during this period? Okay, there's a checkbox in the death certificate. It said medically attended, yes or no. Okay, most of the time, we are the ones that are checking the death certificate. The public health officers, like me. So we are public health officers. I work in Longpo City. I'm a barangay doctor. So I see these death certificates. Those are people that have died at home. Okay, so I ask in Tagalog, nakita ba siya? Nagpa-check up pa siya within the past 6 months? Okay. Sino ba ang tumingin sa kanya? Well, that's much better. Sino ba ang tumingin sa kanya ng doktor? Sino ba mga doktor niya? Di ba? Yeah, I asked that. Who are the doctors? Were they seen the past 6 months? So if because I usually do not see the patients. I just see the death certificates come to me, and then I do what is called a verbal autopsy. I just ask the relatives what happened to this patient, what were the last things that happened to this patient, and then I can surmise by what they say to me the cause of death. Okay, this is part of the training. Okay, so the problem is that most of the time they were not seen by a doctor for the past year. Okay, especially the elderly. The Filipinos, it's inherent in the Filipino culture na tiisin. Okay, to resist the urgency to go to the hospital because it's costly. Okay, even though we right now we have free healthcare to a lot of Filipinos, there is the tendency for a lot of elderly patients to seek healthcare. Okay, because of their previous experiences with the public health system that they had to pay. Okay, they had to pay to get services. Okay, even in public health. So I experienced that. I was nahirapan I had difficulty addressing this to patients. They need the surgery, but they have to pay 10,000 pesos because of the anesthesia, because there was no public health uh, specialist in anesthesia on our hospital. So we had that problem before. But right now we have Balanga General Hospital who have um, none of that. Okay, the anesthesiologists they get paid. Okay, by PhilHealth sharing. Also in San Fernando, Pampanga, in Jose B. Lingad, you usually do not pay when you have emergency surgery. But in other areas that is still undergoing the universal healthcare upgrading, there's still some that have to charge in order to sustain the healthcare system. So in the future, this is going to be addressed by the consulta. Okay, the consulta, and it's going to be addressed by the universal healthcare. But as of now, there are people that die without medical attendance for a year. So this is the problem here. So as you can see here, private physician. How many were seen by a private physician? 8.3%. Okay. So the death certificate can might not be signed by the public health officer. It can be signed by the private doctor. So that's one of the misconceptions. Na pag namatay, if the patient died in the house, um, the public health doctors have to sign them. But that's not true. That's the system now with the medical certificate cause of death. If you are the doctor that saw this patient within the past year and know the you have a record already. You know the diseases, the processes that led to your patient's demise. You can actually sign the death certificate even if you were not there. So that's the misconception with the medical attendants. A lot of the time, ang iniisip ng mga doctors is that ay, hindi ako ang nandoon sa emergency room. It's not me that is in the emergency room that saw the patient, so I'm not the one supposed to be the one to write the death certificate. No, you can write the death certificate because um, you are more knowledgeable about the patient's case. Okay, so that's important. Important to know for medical professionals that the private physicians that saw the patient, even though he did not see it, or he or she did not see it in the emergency room during the time that, or in the ward during the time that uh, the patient died, the doctor can actually sign the death certificate. So let's go here. You can see the public health officer constitute 13.6% only. Okay, most of the time in here in Olongapo, a lot of the deaths are signed by us, the public health officers. Hospital authority, 27.8%. Most of the municipios or the cities, highly urbanized cities, they have a system already that there's a doctor that signs all the death certificate, and no, there's a system to have the death certificate recorded. Okay, so most of the time it's hospital authority, except for those that have no hospitals in their municipios. There are still sitios and barrios and provinces that have no in the Philippines, okay, no access to healthcare, okay, or very limited or basic access to healthcare. 2.2 others, okay, the others are those are not classified, okay, unattended. So most of the time, doctors who sign the death certificate, they say that they did not even see the patient, or that when we are um, asking the relative, there were no doctors that saw the patient for the past 6 months to 1 year. So this is something that is troubling. Not stated, 2.8%. So when you combine this thing, 51.9%, 2.2, 2.8, 45.3. So this is alarming because one, in further, ano po, just in this, in this statistics, half of the deaths were attended. Okay, so only half of the deaths were attended. The other half did not see a physician within the 6 months to the 1 year part that they experienced their demise. So, what does this say about the public healthcare system? We need to do more. Okay, it is a bad. This is a bad thing for the country when seen from the outside perspective. It means that there is a failure. Okay, but that is important. Na the one of the things is that that may be false because meron mga patients that are seen by at least one doctor, but the relatives may not know of it. Okay, that's why it's important to know to have a family doctor, to have a primary physician. So a primary physician can sign on the death certificate so that this unattended part can be reduced. Okay, because of the misconception lang. That because of that misconception, hindi naman ako nakita na namatayan eh. So I did not see that person when he died. But you saw that person, you cared for that person in the past 6 months to 1 year. You're supposed to be the one to sign the death certificate and then check that this patient was medically attended to. So that's one of the things that we are hoping will change within the next few years, decade or probably a decade, okay, of training. That's why I'm posting this on YouTube, okay, so that if you're a medical professional here in the Philippines, you can see this training, this lecture. I'm recording this live, okay, so hopefully, hopefully, um, you get you get to know all that is needed for um, signing that certificate. So place of occurrence. Place of occurrence. Why is this important? Why is this important? Because look, home. 62.1% of Filipinos that died, according to the PSA, died at home. So why is that important? 37.2 health facilities. Why is that important? Okay, they died at home. 50% of the Filipinos are not seen by doctor. They died at home. So if you are viewing this from the outside, it's not a good image for the public healthcare system. If you're living here in the Philippines, you're likely to die at home, not seen by a physician for the 6 months to the 1 year period before demise. So this is something that we are striving in the universal healthcare program. That's why we want Filipino people, gusto namin na yung mga Pilipino ay nakaregister sa universal healthcare so that there is a primary care provider. Primary care providers right now doesn't have to include just doctors. You can include the public health nurses, the public health midwives, the PHWs. So this is the sad thing, okay, about these statistics. So it's something that we need to address, and this isn't just 2021. So I've seen it pre-COVID. Okay, I've seen it in pre-COVID before because PhilHealth or the National Health Insurance Program was not that good before COVID. Okay, now we are striving to have every Filipino have basic healthcare needs. So this is the current, okay, this is the current, so this is going to be the baseline. This is what we're going to work on as a public health um public health care provider, public health care provider. Okay, so we're going to work on this, and then we're going to report probably 5 years from now that this was the baseline and this is how it's supposed to be right now. So we're aggressive in public healthcare systems. Okay, so we're not just going to look at this statistic and say, this is bad. Okay, so we're going to use this as a challenge. We're going to use this as a challenge in the public health system. So wait. Can you see this? Oh, no, you did not. Okay, so here it is. So this is it. Okay, we're gonna go to the previous slide. Sorry. I'm also the one doing the. So we're gonna go previous slide. So this is at 51.9%. That were attended. Okay, public health officer. Sorry, and just in case I didn't yet see the previous slide, temporal distribution September October. Okay, next. Okay, so we're going to go to the next 10 leading causes of death. This is also available locally. I did the slide on the local. On the training in 2021, you're going to see this. Did COVID contribute to the number of deaths? Yes, the significant number of deaths. So it is written here that ischemic heart diseases is the one, 17.7%, 155,775. Ischemic heart diseases is always the top in developing countries or developed countries. So there's this tier of healthcare system. Um, if you are third world country, okay, if you are in the third world country and you have basic healthcare systems or just developing a healthcare system, most of the time the infectious diseases is the top one. So in in the Philippines, which is a developing country, okay, so in America, in the developed country, usually you see non-communicable diseases, okay, as the top one. Okay? But in 2021, just like I said, mas maraming namatay, or there are a lot of people that died from COVID. But wait, look, COVID-19 virus identified is only 9% of the deaths recorded. Wait again, that is 79,423. Look down here, there's COVID-19 virus not identified. So if you, just a rough addition, 80 plus 33, that's 123, I think. Okay, so what? 113. So you're going to see here that the top two is supposed to be COVID, but it's not written here because they were able to. Um, there were a lot of deaths. COVID-19 virus not identified are the deaths that happened in the emergency room because of the symptomatology of the patient. They were written off as COVID-19. Okay. There were a lot of deaths during the Delta period because there was not enough time to do RT-PCR, which was at that time the only way to determine COVID-19. Okay, and that we had no rapid test kits at that time. Philippines did not have rapid test kit. If we did have rapid test kit, this was limited. But most of the time, we had to rely on RT-PCR because of the number of uh, samples during the period of the Delta period. The lag time for results usually lasted for about 2 to 3 days. Okay, we have a molecular lab in Olongapo City, but the lag time at that time was 2 to 3 days before we get the result. So a lot of the patients were classified as virus not identified. So those virus identified were only this one, 879,423. When you add this one, it's significant. Of course, there may be some underreporting because this could be just those that have aggressive reporting, especially in the major cities here in the Philippines. Okay, so you can see that the top, this is the top during 2021. Like I said, the percent change increases because of pandemics. Okay, so this is one of those things, but this is one of those reasons. Okay, so next we're going to find ischemic heart diseases, cerebrovascular disease, stroke. A lot of COVID-19 patients uh, had only stroke. as their symptom. Okay, so yeah, it's one of the recognized symptom or um, adverse effect. No, what do you call this? Yung pathophysiology ng ano is that if it attacks the brain, it can cause a stroke. So it's one of the things that we were taught during that time. So it could be that the cerebrovascular diseases, okay, the strokes, have been identified only here, but it may be COVID during that time. So you can see here, yeah, ischemic, cerebrovascular. The top four is neoplasms, cancer. And then the top five is the diabetes mellitus type 2. They didn't put the type here, so it could be type 1 and type 2. So as you can see, the Philippines is a developing country. We usually do not see communicable diseases or infectious diseases now, but it is seen here during the 2021 period as the top one of the top five. Okay, the top two supposedly is supposed to be COVID-19, but it was not represented here. As you can see, top six is hypertensive diseases. Top seven is pneumonia. Okay. Top so this is 8, 9 chronic lower respiratory disease, which is also infectious diseases, and the remainder of the genitourinary system as top 10. So if you are the decision maker during this time, of course, this is 2021. If this was any other year, you would see that if you are going to address uh, public health programs, if you just minus the COVID-19, we're going to go to the next slide na lang sa ano po. We're going to focus on mostly non-communicable diseases. But during 2021, a lot of these significant data here is that the COVID-19 happened to be one of the main causes of death. And with the upcoming availability of the vaccines, it's important that it be addressed, okay, so that there are no more spikes in later years, okay. So if you are the decision maker, so there's a note here: signs and symptoms not elsewhere classified were not included in the top 10 causes of death. So there is a lot of this undetermined. Okay, we don't know how much. Only the PSA knows how many deaths were labeled as undetermined. Okay, so it was not included in the top 10 causes of death. So that's what it says here. That's what they say here because a lot of the doctors that meet the I know the patient at that time was not able to see this patient, and then the relatives were unable to say any important information. We just put undetermined. Okay, so let's go to the next. So we can segregate the causes of death with males and females. Okay, so this is important, especially since there are specialties for males and then there's specialties for females. Okay, the female patients, they have OB-GYN, they have a lot of other stuff. We can in public health, we approach male and females differently. Okay, so that's why it's important to know what are the 10 leading causes of death. Because if we're going to address them, we're going to say this is the statistics that we are telling them. Okay, that a lot of males are still dying from ischemic heart diseases. And then we're going to tell them about the demographic of these ischemic heart diseases, why the working population needs to be wary of ischemic heart diseases and stroke. Be wary because these are lifestyle diseases. Neoplasm cancer, this is a lifestyle disease. If you are currently smoking, you can get all of these lifestyle diseases. Okay, so that's important to know and that's important to share among our male patients. Okay, but then this is marred by the COVID-19. Okay, this is marred by the COVID-19. Among females, it's almost the same. Okay, but as you can see, more females have cancer. I'm going to repeat that. During 2021, 10 leading causes of deaths. The second one is neoplasms. As you can remember, what I said before in the previous slide, most of the frontline workers that returned to the employ during 2020-2021 period after the lockdowns were males. Okay, most of the females chose. We encourage most of the females not to go out, especially those that are pregnant. Okay, because they are prone to have COVID-19, especially when they're pregnant. COVID-19 severe, especially when they're pregnant. So it's important for females to stay at home, okay, take care of the family. So as you can see here, COVID-19 is not that much, okay, 36,000 plus, 14,000 is 50,000, so it's second still, okay, for the COVID-19. But what's important here is neoplasms. Why are females having more cancers than the males? Let's go to the previous slide. Am I streaming this correctly? So this is a question that is important in public health. Okay, so what are the neoplasms that causes this among females? Is this just 2021? Okay, is can this be addressed by a public health intervention? Cerebrovascular diseases is just third. So if you're going to have a public health program, you're going to approach males and females differently. Males have more in stroke. They die more in stroke than females do. So, what are your interventions, public health interventions that can decrease these causes of death? So that's important, okay? And then you can see that pneumonia, okay, is below. Could be COVID that during this time. Okay, and the remainder of the diseases of genitourinary diseases, and then heart hypertension, heart diseases. So these are important when you're addressing the the public during public health intervention. When you address them in a setting like a community setting, you're going to tell them mas marami po sa inyo namamatay sa cancer, okay, than males. Pero if you look at the smoking, more males are smoke than females. So what is causing this cancer among females? What can we do? So that's important. Okay. So next, 10 leading causes of death in Olongapo City. So here, this is the problem po. Okay. What you're going to see here is the quality of the number of death certificates. Okay, the quality of the death certificates, but not the number. The quality of the death certificates that we're writing. So we are writing top one pneumonia, including community acquired pneumonia and aspiration, top one. Most of the doctors here in Olongapo City still write fatal arrhythmia, which is why it is written as top two. We did not write if the patient had hypertension before or diabetes. This is much more that can be addressed to than fatal arrhythmia, unless fatal arrhythmia is the only cause. Like in sports, we encounter fatal arrhythmia happening with electrolyte imbalance in sports or in steroid use. But that's isolated cases. But why is it there? Top two, myocardial infarction. That's nice to write myocardial infarction because it's ischemic heart disease. So will this be included in the national data? So hypertensive cardiovascular disease is hypertension. Top four, diabetes mellitus. Top five. Top six is acute respiratory failure. Why? Usually, a lot of doctors write acute respiratory failure because of pneumonia. So why not write pneumonia, okay, instead of ARF? Because ARF can happen in other systemic diseases, but that's what's written in the death certificate, and that's why it's top six. Ang problem kasi dito is the problem here is that if you are the um, city health officer or the LGU, will you be able to create a program, okay, addressing acute respiratory failure if acute respiratory failure could have been caused by COVID, or could have been caused by um, renal diseases, or could have been caused by hypertension, or could have been caused by pneumonia. So it's um, it's a very vague not cause of death to address as a public health officer or by the LGU. So mahirap siya. So it's better if you say, he had acute respiratory failure, or just write because he had diabetic nephropathy. So it's diabetes. Diabetes killed this patient. Or the acute respiratory failure was due to pneumonia. So we include the number in the pneumonia. So we are going to go to the LGU, the mayor, then tell them, Mayor, we are experiencing a lot of infectious diseases because this is the number of infectious diseases. The number of pneumonia cases are mataas 2023. So that's important for the decision makers. But in here, you can see a diagnosis that is vague. You can see here fatal arrhythmia is vague. Cerebrovascular accidents and cardiovascular diseases were uh, clustered into top seven. Multiple organ failure, another diagnosis that is uh, we are hoping that we remove from the death certificate. Most of the time, multiple organ failure is written by doctors, but they do not know that, especially if they do not know why the patient died. Okay, you are to only write multiple organ failure if there are two or more organ systems that fail. You have documentation that there are two or more systems that failed to lead to the demise. But right now, that was before this training. And then in this training, we are trying to tell the doctors not to write it anymore because a lot of times this is not substantiated with evidence. Also, it does not help. Okay, so if the multiple organ failure happened because of CKD, it's much better to put it there. CKD, secondary to diabetes, or hypertensive cardiovascular disease. So we can classify them into those diseases that the decision makers can now, we have a problem. We have a lot of patients with diabetes. Olongapo City needs diabetes clinics, okay, to prevent CKDs from happening, dialysis centers that are sprouting right now here in Olongapo City. So instead of having a lot of patients with renal problems, maybe we can stop those renal problems by telling the mayor, we have an alarming increase of diabetes mellitus patients. How we're going to show that? We're going to change this one. The multiple organ failure, you say what failed, okay? Is it due to the diabetes? Is it due to the hypertension? Okay, instead of just writing multiple organ failure. Chronic kidney diseases, again, hypertension, diabetes. If you uh, I mean, if you add the data from these two and then put it in the proper category, okay, you can have a much accurate information to tell the decision makers, like the mayor. So pulmonary tuberculosis top 10. This is actually a growing problem after 2020. During the lockdown, there was very little patients that had tuberculosis, okay, because the tuberculosis is a communicable disease. Okay, it requires person to person transmission. During the lockdown, it decreased, but after the lockdown, it increased. So, why is that important? Pulmonary tuberculosis can be prevented by simple hand washing, cough etiquette, okay, and simple lang na mga early intervention, early seeking early care, okay, to be in the top 10, that's alarming. Okay, so importante, it's important that pulmonary tuberculosis also have to be addressed. Even though it's in the top of the list, it still has to be addressed. So when you are having a meeting with the local health board, it's important that the priority be with the top 10 leading causes of death, diba? So yun yung way. That's the way to approach a meeting with the local health board annually. Okay, so that's this. This is I know this is how this is used. So ranking, that's among males. Within the past 12 years, 10 years, okay, let's go with the pointer options. Laser pointer. COVID-19 during 2020 was not even in the top 10, but in 2021, when we released the patients, it became part of the top 10. It's actually top 2, but they segregated it and still, you know, uh, akala mo na in top 3, top 8. No, it's top 2 actually. So ischemic heart diseases historically is the top. Okay, in developing and developed countries, it's always the top. Okay, it means that the healthcare system for communicable diseases is for infectious diseases. Kasi if you are still in the first phase of the, I don't know, is you have no developed healthcare system, the most of the number of the leading causes of death is usually the infectious diseases. So if you have non-infectious diseases, non-communicable diseases, it means that you are already in the top tier ng mga countries, okay? But if, as you can see, it's still the top, okay? If you're going to be the one budgeting for male population, what are you going to tell them? That the main causes of death is still ischemic heart diseases. You have to give them proper guidance, okay, to lower this ischemic heart diseases, to lower this stroke, okay? And then neoplasms used to be the top three, okay, top four, bumaba, top three pa rin, it's still cancer, okay? Cancer is a big problem in the country, okay? And then it became top four because of the entry of COVID. Diabetes mellitus used to be top 9, top 7, top 8, 7, 6, 5, and then it went up. Okay. Diabetes Diabetes Philippines is a organization here in the Philippines that projects that the diabetes is actually going to be the top one within the next 5 years. Okay. The diabetes population is increasing, okay? Not just because of the testing, but because of the lifestyle. It's increasing because of the sedentary lifestyle of Filipinos. This thing increased. Look at this, 2012 to 2020. What are the technologies that increased during this time that is making people sedentary? Because diabetes mellitus is a lifestyle disease. This happens primarily because of lack of exercise, not because of sweets, ingesting a lot of carbohydrates. It's about not using those carbohydrates because most Filipinos right now lack exercise. That's why it's going to increase and increase until we give that message to the Filipinos that you need to exercise. Hypertension used to be below, okay, and then it also went up. Okay, so this is part of the sedentary lifestyle. That's why in the US they are addressing this differently. They are already incentives so that people at work can actually exercise. Okay, I've seen it firsthand when I went to Virginia Beach. So the firefighters they have 1 hour for their physical training. They have gyms. The Google offices, they have playgrounds for people to be active. They have standing desks. Okay, so those are things that you can address so that these lifestyle diseases can be decreased. So pneumonia is decreasing. Okay, but with the advent of COVID, this constitute a big part of the communicable diseases that is ravaging during the 2021 period, ravaging the countryside during the 21 period. So we're going to skip the COVID-19, chronic lower respiratory diseases, okay, COPD, asthma. They are decreasing, okay, because it's very easy, especially since the Duterte administration banned smoking in public areas. Okay, so this is the result of that. Okay, it's decreasing the COPD, okay, is decreasing because of ban on smoking or the difficulty to get cigarettes, but it will slowly increase because of the increased availability of vape. Okay, so this still creates particulates. Remember, genitourinary system was decreased before, but it became the top 10. The respiratory tuberculosis. So it used to be on the top and it's now decreasing. What does that say? That the tuberculosis program is actually effective. So other heart diseases, congenital heart diseases, okay, still below. Okay, transport accidents. What does that say? That the safety, public health and safety, okay, in the Philippines in concerning road safety is actually good. Okay, except here pre-COVID it was top 10. Mm, Females, let's go to the females. So as you can see, neoplasms 3334, cerebrovascular diseases, okay, COVID-19, pretty much the same, pretty much the same explanation. Okay, pneumonia dropped, chronic lower respiratory diseases drop, respiratory tuberculosis drop. Pre-COVID, to TB was mainly funded by a lot of international agencies. So this is why tuberculosis dropped significantly during the COVID pandemic, and then it's increasing now because a lot of those international agencies have stopped to because they already see that the Philippines has already controlled the TB pandemic, but unfortunately, when the problem is sustainability right now with tuberculosis, and we are seeing increasing tuberculosis right now. This is 2021 data, and what I'm saying is the 2025 data. So other heart diseases there, okay, congenital heart diseases. So it's pretty much the same explanation. But if you're going to view it in your organization, these are important factors. Okay, so we address males and female patients during public health seminars differently. So because they have different needs, so that's important in public healthcare system. So that 10 leading causes of deaths among infants. As you can see here, there is still some problems with the quality. Okay, so bacterial sepsis of the newborn tells us that a lot uh, uh when you have infant mortality, you this is one of the things that you have to address. Okay, so bacterial sepsis of the newborn happens often due to maternal uh I mean maternal to fetal transmission during the puerperal or the uh birth during birth. Okay, so the newborn usually is protected by the placental barrier. Okay, but when he is born, he's exposed to the outside world, and if there is infection in the mother, okay, the baby gets that infection, and since it's immunocompromised, the baby usually dies. Okay, so it's important. This is an important data. So it reflects maternal health care. Okay, so bacterial sepsis of the newborn is not just a problem with the birth. Okay, most of the time, um, uh, in the Philippines, it's already a good system. We have a good healthcare system when it comes to birth. Unfortunately, it's the prenatal care. Okay, so when we are seeing this bacterial sepsis of the newborn, in Egypt, we're thinking that the prenatal care was not enough. Okay, so it's important. This bacterial sepsis of the newborn is important to know because this can be prevented with antenatal care. Respiratory distress of the newborn, this is much complicated. Most of the time, this is not due to the antenatal care. This is due to an inherent, due to prematurity. So respiratory distress of the newborn, or pneumonia, hospital-acquired pneumonia is very isolated case. There are very isolated cases for this. So remainder of the perinatal conditions, we have no idea what these are. Other respiratory conditions of the newborn, cause of death, okay. Congenital malformation of the heart, so babies that were born blue, undiagnosed or not able to get fetal surgery. Right now, that's a thing that is happening here in the Philippines, that the availability of fetal surgery is increasing now, okay. So hopefully these malformations, congenital malformations of the heart, also in the spine, can be addressed by fetal surgery. So congenital pneumonia, okay, so again, this can be classified into bacterial sepsis of the newborn, but it's classified differently. Other congenital malformations, pneumonia, again, pneumonia. So pneumonia can be hospital acquired or community acquired, depending on whether the infant got this, but when. Because infants in the DOH definition is birth to 1 year old. Okay, so pneumonia can be community acquired. So you can get pneumonia during that 1 year period. So intrauterine hypoxia and birth asphyxia due to tangled cord, okay, uh, is a problem in the healthcare system, public healthcare system, because if this happens, it's probably because of um, ano to? The monitoring in fetal monitoring during birth, okay? Because one of the things that we are trained to do as doctors is to see if there is a increase in the fetal heart rate, tinitingnan kung bumibilis ba or humihina. Is it increasing and decreasing? That's already sign that the patient, the baby is already having either hypoxia or asphyxia. And then the next recourse of action is, if for our medical students, the next course of action is supposed to be cesarean section. But if you are in isolated healthcare area, you see this, and then um, the next level of care for a cesarean section is about an hour, 2 hours away. There are places here in the Philippines that have uh, the nearest emergency facility is about 1 hour to 2 hours away. I was able to visit one of those facilities at one of those areas recently, and then I just saw that, wow, anybody who had an emergency outside of the area of the hospital is going to have a really bad time. So, intrauterine hypoxia and birth asphyxia is a problem of the public healthcare system. So this means that there are still areas that need to be addressed. Okay, it's not here in Olongapo, if you're going to ask me, because here in Olongapo we have a lot of that we have a very good EMS, emergency medical services. Okay, so we don't usually encounter intrauterine hypoxia and birth asphyxia, but in other places in the Philippines, especially because Philippines is a island nation. There's a lot of islands here in the Philippines, and a lot of those islands only have one hospital, and that hospital can only be accessed by one road. So I was able to see it firsthand, the difficulty. So if this can only be addressed by having more training in that. We need more OB-GYNs to have their practices on other areas in the Philippines, so that this can be addressed. Okay, so diarrhea and gastroenteritis of presumed infectious origin. This is another public healthcare problem. Okay, so infants again, birth to 1 year old. Okay, so if they have diarrhea, diarrhea is fecal oral route. We are we are advocating breastfeeding up to 6 months old. Okay, so diarrhea should not be a problem because there is IgA, in fact, immunoglobulin A being transferred, so it's not supposed to be a problem, but this is why this is significant. So there are areas of the country who do not breastfeed. Okay, there are areas of the countries who do not have access to a good primary care system. So This is important part. We're not supposed to see diarrhea or gastroenteritis. If you are to see them, it's supposed to be a very low number. Okay. So next, maternal deaths. Maternal deaths is very important in the global setting. Maternal, um, the buntis or the pregnant patients are immunocompromised. Okay, so if a patient smokes, if their spouse smokes, they get disease. If they are exposed to tuberculosis, they get disease. The maternal population, if they do not have public health care in their area, they die. Okay, because of eclampsia. This is the one thing that we are trying to prevent and can be prevented by having antenatal care visits. Okay, preeclampsia. Okay, this is hypertension in the pregnancy, which can be easily be screened by having blood pressure checkups. So this is important. So important to be addressed. So in highly urbanized cities like ours in Olongapo, this may not be a problem, but in other areas, this is a constant problem. So eclampsia, preeclampsia, there are that in the global health setting, they are seeing the Philippines as a, oh, you still lack some healthcare systems, primary healthcare systems in some of your areas. Pagka nakita nila to, it's still there's still some failure in the public healthcare system. So it's important to reduce maternal deaths. So infections, parasitic diseases, complicating pregnancy, childbirth in the puerperum. So this is also due to antenatal care. Yeah. Why is this high? This means that there are pregnant patients who do not have the minimum for antenatal care in the country, and that has to be addressed. Okay, so that's important. That's why these are statistics are important. So, gagamitin niya ng commission population, you need to go to the health centers. If na buntis ka, if you got pregnant, you got the pregnancy test, go to the health centers. That's the important part. We teach them in schools. This is statistics that we show them. Okay? When you get pregnant, you get a very high percentage of dying from these diseases. So the next are the common things that we encounter during birth. Okay, why the patients die. Okay, so postpartum hemorrhage, maternal diseases classified elsewhere. Well, we don't know what these are. Complication of the puerperum, not elsewhere classified. We also don't know these are. This is dystocia, ectopic pregnancy, obstetric embolism. This is preventable, supposedly preventable. Um, this is post-op. I think this is a post-op complication. Unspecified abortion. Okay, so these are the things that are the 10 leading causes of maternal deaths in 2021. Temporal distribution of maternal deaths. Okay, so here in Olongapo, we only have very few maternal deaths. We have four for the past year, three, four, used to be zero. There used to be no maternal deaths, but since Olongapo City is a area for a lot of people that are transient. We call them transient people because there is work in their Freeport area. So there are a lot of people coming from the outside that bring with them yung culture na magpapa-check up lang pagka malaki na yung they only have their checkup when their bellies are really big. So usually their mothers teach them they only go to the health center after 3 months. So usually some of them do not actually go to the health center and only go to the uh, those are the maternal death review that we had here. A lot of them did not have at least one antenatal care, so that's important to know. So here, year number 2010, 17 to 19. Okay, so it's increasing, it decreases, increases, decreases. Why? Because of like here. decreases, increases, decreases. It's about public healthcare. So if you intervene, try because we have it's like what we call in and out. There's battle and blessings. Okay, so there's a battle here, and then we try to there's tumaas yan, tumaas. So we address it if we continue addressing it, the problem of maternal health care, it will continue to go down. But if we forget, because there are a lot of international aid coming in, we are addressing tuberculosis, we are addressing a lot of diseases. So sometimes the maternal and child health care program is um, they decrease your priority. Okay, they decrease the priority in some most of the healthcare system in the country. So you can see that it's okay, it's going up again, and then because it went up, we have to address it again. Okay, and then if it's sustained, it's still low. But if you forget again about addressing the maternal health care, it goes up, and then we address it again. But what happened here is that a lot of patients died during pregnancy. A lot of patients died during pregnancy during these 2 years. I remember that sudden death case. We have a lot of sudden death case in Olongapo City because of COVID-19. Okay, so this is one of these. These and up. Okay, so I remember that because one of the first cases was a 21-year-old female. We were monitoring because we did not have a COVID facility at that time, so we have him home quarantine. But we had him, our uh, barangay health workers and nurses were monitoring every hour, texting the husband whether she's okay. She keeps saying she's okay during the isolation period, but suddenly she was not answering. We had to get the ambulance there, and then she died suddenly. Okay, there were no symptoms prior, but she just died suddenly, and she had COVID-19. Okay, so it's very dramatic and very fast for um, pregnant patients. Okay, to have COVID. That's why it's important that back then that so we had to do a lot of strict procedures before admitting the patients in hospitals, and then that's why there's a lot of maternal deaths here. Okay, so COVID caused all of these things. The next causes of fetal deaths, birth asphyxia. Okay, is the usual go-to because most of the time the fetal deaths they are due to um parents and pregnant patients that had 0 to 1 antenatal care. Most of the time, zero. Okay, so they do not know why the why did the we usually do not know why the baby died, and we write birth asphyxia. We're going to find out why this is not a good practice. Okay, in the later modules. So disorders to short gestation, low birth weight, not elsewhere classified. Okay, so usually due to teen pregnancy. Other conditions, we don't know these other conditions, other congenital malformations. I have no data here. So as you can see here, fetal death of unspecified cause was excluded. It's probably a lot, okay? A lot of the fetal deaths, we have to write unspecified cause because most of the time, the relatives, they do not know the conditions, the maternal conditions. Okay, even the mothers themselves, they do not know what happened because they never had the checkup before. So this reflects the public healthcare system. That's why we here in Olongapo we go nagbabahay-bahay, or we go to each home asking who is actually buntis, who is pregnant, so that they go to the healthcare system. So it's part of our health promotion to ask these pregnant patients to go and seek healthcare because this is the fetal demise is very very prevalent. Okay, if you do not have at least four checkups in public healthcare institutions. So these are the common causes of deaths in fetal deaths. Okay, so respiratory distress of the newborn can only be diagnosed here in the hospitals. Neonatal aspiration syndromes. So this is what this data tells us. So it's still a problem with the healthcare system, and we're still continuing to address it. Okay, and hopefully, because I'm already doing this as part of a public health program, telling public health professionals like you, or training public health professionals like you, to address this. Maybe in the near future we can see this decreasing, these statistics decreasing. COVID deaths, temporal distribution. We already discussed this. This is 2021. Am I right? Oh, 112,772. Okay. So we've already discussed this. So August, September, October. As you can see, September, October is in Olongapo. In the rest of the country, August, September, October. Okay. So where are we? In the UNESCAP targets and baseline data. UNESCAP is the UN Economic and Social Commission for Asia and the Pacific. They are the ones that set these goals. They are the one that is trying to upgrade the civil registry and vital statistics in the Philippines. They want a 2024 target. That was last year. Okay, that was last year. Last year they wanted that all births is 99% to 100%. Deaths registered 90%. Okay, there are actually, because of the indigent population, they had this allowance created. Okay, and then medically attended registered deaths supposedly is supposed to be 85%. At least 85% of people dying should have a healthcare provider seeing them. Okay, so reduction of ill-defined or unusable COD. We're going to go through this in later slides. Okay, 0.45% only, and then community deaths with underlying COD determined through standard VA 85%. Standard VA, not smart VA. So what we're doing, writing in the, I don't know, is usually called verbal autopsy. Okay, we talk to the relatives or the relatives to determine the cause of death. Okay, even though we did not see the patient. So the 2010 data showed that 94% are only registered for births. 66% of the deaths were registered. Medically attended registered deaths, 34%. It was really bad during the start of the program by the UNESCAP, UN Economic Social Commission for the Asian Pacific. So they started with 34%. 0.9% for ill-defined unusable codes. This is module 2. Okay, and then no data for the VA because they haven't started it yet. Okay, so next. So reflection of the public health in the Philippines in 2010, 2020. So this is 2020. Give up pa yung sa 2021. Sa 2021, it was 1 out of 2. 2023, it was 1 out of 3. Only 1 out of 3 was 1 out of 3 is medically unattended. It increased in 2021. 1 out of 2, okay, is medically unattended. So what does that say? It's a reflection of the public health care in the Philippines. So it's something that we are trying to minimize right now. Okay, so one of these is by training those that are signing the medical certificate. Was he seen by a medical professional? Did you see him within the past 6 months to 1 year? If you are not the one that saw him in the past 6 months to 1 year, you can relegate the writing of the death certificate to that doctor. Okay, so that he can write, I was able to medically attend this patient. Okay, next. So CRVS in the 2021 were we able to meet the target? So births registered 96%. It increased, but it's not there yet. So this is 2021. I think this was increased na because we need to reach 100% for the universal healthcare program. Okay, we need that every Filipino must have universal healthcare. So deaths registered increased 92%, which is good, but the registered deaths only increased slightly, 56%, 2021. That's already 11 years. Okay, reduction of ill-defined, we're still having unusable causes of death. Okay, with zero R codes, this is the what do you call this? R codes is used for diagnosis. Okay, so they are unusable. They cannot be used as part of the statistics. 1.2% cannot be used as part of the statistics. The standard VA, 85%, still no data because it was only in 2020. We're going to go through that. It's only in 2020 that the uh, administrative order was passed, okay, in the Department of Health to upgrade the quality of the death certificates. What are the problems identified? Low data quality. So in the next modules, we're going to show you how bad death certificates are written by doctors. Okay, so low emphasis on death certification. There is no training. I remember going to my first death certificate during clerkship, okay, and being taught only to realize that the resident doesn't even know how to write the death certificate. Okay, and he has to ask somebody who also do not know how to write the death certificate, and then we are just writing what's inside the chart. So lack of investments in CRVS because they identified that as a problem because there's not enough training. And right now, the access to the training is zilch. Okay, it's hard to get to the DOH learning program. You are not going to get certificates from me, but this is exactly what is going to be taught in the DOH learning program. So low data utilization. Uh, you know, it's just sad, that a lot of the efforts during the 10-year period was focused pre-COVID was focused on tuberculosis, HIV, when they are not even the ones that are uh, the top leading causes of death. That's data utilization. Okay, so if you're going to have programs, knowing in the past 10-year period that it's ischemic heart diseases, cerebrovascular diseases, hypertension, and diabetes causing the top tier of the 10 leading causes of death. You're supposed to utilize that data to enact programs in non-communicable diseases. Okay, next. 10 to 19% of records from 2013 to 2018 have ill-defined or unknown causes of death. They just write whatever they want. We're going to see that in the next, in the next. So that's the problem that is trying. We're trying to solve here. We're trying to solve this. We need to have a more valid cause of death because what do you call this? We're going to use those statistics to convince decision makers. This is the one that they have to focus on. Okay, so that's important. So let's go. Importance of vital statistics in the health sector, data on the prevalence and distribution of mortality by cause. This is used in research, yeah, but most of the time this is used in decision making. So that's the important part. The identification of health inequalities. Males and females have different problems. They have different causes of death. Infants have different causes of death. Pregnant patients have different causes of death. So it's important that in these inequalities be addressed, okay, and be addressed correctly. This is why this looks like this is actually wrong. This is the staff of Mercury, not the staff of Asclepius. This signifies commerce. So, but this is the DOH slide. This is the Department of Health slide. It just shows the justice balance, the balance is to show that there's supposed to be justice. Okay, that the proper people are supposed to receive the proper health care. It's just that the what do you call this? The image here is wrong. Okay, this signifies commerce, not healthcare. Resources allocation. Where are you supposed to put them? Are you still supposed to put them all your resources? Resources doesn't have to be money, okay? This also has to be persons, people that people that uh, deliver service, people that I know decide the administration. Resources allocation is important. You do not want your resources to be focused only on one thing. Okay, so primary source of public health information on births and causes of infant, neonatal, and maternal births in a defined population. So yeah, let's go next. Assessment of health system performances. So we do this a lot in the public health. So they keep telling us, oh, you're lacking this. Oh, you're not reporting this. So this health system performance tells us, hey, like that, what I showed you earlier, that tuberculosis is decreasing prior to COVID. Okay, so if we do the same thing, it's increasing now. Uh, because we have, no, there were international aids pulled out because it's all they already see that they already saw that it's decreasing. So international aid pulled out. So what's important right now is sustainability. Kaya bang ma-sustain yung todo-todong pagbaba? Nakikita na hindi. So it's increasing, but we're going to try to to do the same things. Well, create the same programs. It's not that hard to I know to address the problems in tuberculosis. Okay, so you can see that with the health with the vital statistics. Okay, so understanding emerging health challenges. So we did not have COVID before in the top 10 leading causes of death, and then suddenly it's there. Okay, we have COVID, and then that's something that we need to address immediately because that's important to address immediately at that time. Okay, so emerging health challenges. Okay, so that's the pandemic caused a lot of deaths. Next. Okay, the certification process. This is part of module 2, but it's with something that you need to know in module 1. There is an administrative order from the Office of the Secretary. It's number 2020-008. We refer this a lot to hospitals. Okay, we refer this a lot to hospitals because they do not have that they do not have the training yet. A lot of them do not have this training, and then this has to be addressed. Okay, the death certification process, there is already an order, and then we do not want our hospitals to be surprised when there is already monitoring going on. Once the monitoring goes on, a lot of the, if they do not change, they may have problems with their certification. Okay, so that's important, and it could happen anytime from now. So AO 2020-008, this is part of the AO. Hopefully this displays well on YouTube. Fortunately, probably won't not. This is available in Google. You can just type AO 2020-0008. Okay, so it establishes the procedures and defines roles and responsibilities for reporting, certification, and review of cause of death. Next, so the objectives of this AO is to provide standard procedure for reporting, certifying, and reviewing the cause of death. So this is what this training is about. I want you to have the knowledge, to have the SOP for all of this so that you can write the cause of death clearly. To standardize a procedure for referring cases of death which warrants medico legal investigation. To clarify the roles and responsibilities of the different key actors in reporting, certifying, and reviewing the cause of death. Once there is a system for review, most of the hospitals that do not follow may find themselves in uh, uh, having problems with the licensing. So to establish the use of verbal autopsy in specific cases for cause of death determination. We are already doing this, but we are going to do this systematically. To monitor compliance and violations of existing CRVS laws and regulations in reporting, certifying and reviewing the medical certification cause of death. So this is going to be a problem in the near future, very near future, because once they start to regulate the death certificate process, if you don't know, if you are not trained, you will find yourself in trouble. Okay, so right now in Manila, in Quezon City, maraming mga doctors ay nagugulat, okay, that death certificates are being returned to them. Okay, we are also doing this in Olongapo City. We are returning to them death certificates that are very vague and that are so wordy that they do not have a place in the vital statistics. So next. So operational procedures and practices innovation. So besides Administrative 2020-008, we have DC number 2022-0293 or the interim guidelines on the assessment of MCCOD in health facilities. Again, health facilities. 23, what is it? 28 point something is written in health facilities. If they do not follow, they will face legal action or probably license. Their license may be revoked. Okay, even if it's in public health. Okay, so that's why I'm doing this to speed up the process. We're going live here on YouTube so that we can speed up the process. So there's a book going on, Guidelines and Procedures. There's already a revised second edition. I was able to see this book with one of my, if one of my colleagues have this book, it's the handbook for Filipino physicians. I do not know how to get this thing. I'm trying to get this in the Department of Health. I cannot get this in their usual channels. If I were able to, I'll be posting it on on the description of this video below. Otherwise, it will be available only by distribution by the Department of Health. They will have. They already have, I think, an e-learning course in the DOH Academy. The only problem is that you need a key. Okay, most of the even us na meron ng mga accounts DOH Academy cannot access the MCCOD because they're doing this piecemeal. So they're doing this in different medical schools. They're doing this in different. They're starting in Manila. Okay, so they're starting in Davao, Manila, Cebu, the major cities here in Philippines. So hindi siya readily available. Standard MCCOD instructional design should be integrated in the medical school curriculum. So those in DMTCS, you're welcome. We are already integrating, I'm already integrating it in the medical school curriculum, and this may be different from what is taught to you in medical legal. So that's why I included a pre-test for this before. You're supposed to answer the pre-test before so that we can see the before and after. It's not going to be graded, the pre-test and the post-test. It's a way to make you see how you write medical certificate cause of death before and after this training. So I hopefully sana ginawa ninyo yung inyong assignment. Okay, so MCCOD and CRVS handbook. So I do not have access to this except if I borrow this from a colleague, which is going to be a very bad way to do this. I'm going to have to ask the Department of Health to give me one of these handbooks. So CRVS 4 health milestones. They call it CRVS 4. This is a recent reiteration. This is the past 10 years, like past 10 years. So 2009, they already had their assessment. The national and subnational CRBS assessment. 2010, they already have training for health professional encoders. 2010, I did not receive this training. Okay, but I know that there's ICD-10. This is the R codes that I was talking about. Then the TOT and the medical certification cause of death happened in 2013, the first ones. Okay, then MCCOD and CRBS handbooks were given, but it was not rolled out to all of us. Okay, so this is because of the, what do you call this? Yung priority is not on the debt certification, but they were able to do some rollout training. Okay, that's why some people do know how to do this, but not a lot. Start of revision of the civil registry form. So this is version 3, I think 2. There was a previous form. Okay, I was able to see the previous form. I was able to use the previous form. There were no check boxes on those. That right now may mga check boxes na hindi ko alam bakit nandun. I have no idea what those check boxes for before this training. Okay, so then they revised this in 2016. Then legal review happened on 2018. CRVS laws and policies, medical legal death investigation bill happened in 2018, and then training on the medical legal death investigation happened in 2018. And then the first e-learning course happened in 2019, TOT on Smart VA. This is a computerized program. Pilot testing of Smart VA was successful. Unfortunately, COVID happened. COVID happens 1 week after the DOH admin order happened, 2020 Series 6, which is why this rollout of training was delayed for about 3 years. Integration, they started with 30 medical schools, but it's not that fast. There are about 200 medical schools out there. I saw the list. After PRC, there were a lot of medical schools that sprouted here in the Philippines. MCCOD instructional design, while on lockdown, they were able to still do this. They included MCCOD in the medical board exam in 2021. So, if you are still taught the old version of the cause of death, you may be able to only answer the old version in the MCCOD medical board exam, okay? But it's better that you know the new version of how we do the MCCOD start of transition ICD-10, ICD-11, 2022 online death certificate assessment module. So they start online comprehensive CRVS assessment, and then we are part of this CRVS strategic plan and investment plan 2023 and 2028. Okay, so almost there. Ways forward. They are trying to finalize the Omnibus Philippines CRVS bill. I have not heard this in the news yet, so they're probably still advocating the bill. Develop a joint administrative order on debt under medical legal examination. This one is a lot faster because medical legal investigation is part of the Department of Justice system. Identify champions, legislators, cause-oriented groups, and other lobbyists. Okay, and then ways forward. Okay, memorandum capacity building. Memorandum for understanding with AMHOP, the Municipal Health Officers Association in the Philippines, for institutionalization of the medical certification of the cause of death and verbal autopsy trainings. We tried this. Yes, we have already rolled out medical certification among medical doctors here in Olongapo. Unfortunately, on there are a lot of new medical doctors which are still following the old ways, okay, of writing the medical certificate. So expand implementation of MCCOD instructional design to all remaining Philippine medical schools. So you are part of the all remaining Philippine medical schools. So I'm teaching you this. Hopefully you get the idea. Revise the handbook on medical certification cause of death in accordance with the implementation of the new death certificate form and advocacy. So populate the CRVS. That's them. Interagency committee is already done. 2015. Develop a CRVS communication plan approved by the interagency committee. Strengthen partnership with CRVS stakeholders. So that's what they're trying to do in 2023, and hopefully they're still trying to do that now. Populate the yeah. Okay. Conduct training on institutionalizing CRVS. So as an end note, CRVS begins and ends in the health sector. So it begins because we are the ones giving birth to the patients and ends because we're the ones signing the death certificate. So it's important that we be able to write the proper death certificates in a in public health. So my experience yan, araw-araw halos if you go into community medicine. Okay, it's going to be every day that you're going to experience this in community medicine. So that's important. It's important to learn this, and hopefully you go through all of the modules here as we discuss first here in the importance, and hopefully if you have questions, you write them down on the comment section below. Okay, I'm not requiring that the my students like and subscribe. because, you know, I have a lot of other videos here that may not suit them in my channel. So here, maraming salamat po. This is the last slide from the Department of Health. And hopefully you learned something why medical certificate cause of death is being trained. The training is being given to medical doctors, medical students. Okay, so with that, I hope you have a good day, and I hope that you go continue the second module of this training. Okay, so as I check, it's already 2 hours since I started, and I hopefully we can still continue that's why I recorded this. It's much better. If it's face to face, it may take us about 2 to 3 days. Hopefully you can do something about this lecture, the playback. You can do this 1x, 2x, or you can just go back and review. Anyway, this is me signing off for the module 1, and I'll see you on module 2.